The second question from our parent is, my daughter appears to be quite extroverted at home. After 2 weeks intervention, she can now answer questions. Therefore, I believe she doesn't have severe case of SM. With continued intervention, will she become completely normal in the future? And the second question is, my daughter can answer questions from stranger in open public setting, like in a restaurant or in a shopping mall, but she uses a suppressed, hushed voice, which is different from her normal voice used at home. Is she considered to have been desensitized in these situations, or is there still a long way to go? Please.
Thank you for your question. I think that you touch a lot of topics that I could talk for hours about. So all of the questions actually. The question is if your child will be completely normal. The question of normality is not something that we discuss in this context, in that we talk about selective mutism, which is a diagnosis and is a neurodevelopmental condition. It is in the DSM-5, it's a psychiatric diagnosis, but I see it as a neurodevelopmental diagnosis. So we look at this, and when do we diagnose a child with selective mutism is when the child is showing impairment. So instead of talking about normal and not normal, let's talk about impairment. If your child is showing impairment in those certain situations, then she's suffering from it, either emotionally, socially, educationally, then we attribute a diagnosis. Somebody may have symptoms that are not so different, but they're not having any, it's impossible not to have impairment from them, but it's the impairment that we see that we need to address it. So in terms of your question, you mentioned that your daughter has had intervention for 2 weeks and she's already answering some questions. And I'm very happy to hear that, because I hope that your child is receiving intense intervention. Intense, what I mean by intense is every day or twice a week, and a lot of in the office and almost every day at school, with intervention given by the therapist, by the parent, by the teacher. I tell parents to have play dates more than you want to have, especially now in the summer. I have a lot of recommendations for the summer. So I think that your daughter is functioning in a much better way than she was when she first started intervention. So congratulations for doing what you're doing, and continue doing what you're doing, because it is working really well. So we know that if we give intervention that is appropriately done in intense manner, that it will work. Now, in terms of, there are a lot of variables that may play a role in more success of therapy. So one of them is the parents, the teacher, and other people contributing. So let's talk about the fact that she's already answering. And again, I don't know your child's age, unfortunately. And next time that we have questions, when we have new ones, it would be really good for me to have. I cannot answer specifically, but at least I can make some recommendations that are more age and developmentally appropriate. So in this case, it's not uncommon to have children speak in a different voice, either lower voice. Sometimes they speak in an infantile voice. So it's not that uncommon for children to do that. So what happens is, what I would recommend, remember the 3 elements that I talked about at home, playing with your child, depending on the age of your child. Prepare and rehearse to go to a restaurant, for instance. So in a public place, and you practice. What I tell parents is to download the menu of the restaurant where you're going, so that you can practice and play games with the child in doing that. And then you reward her for using her own voice and for projecting her own voice. So once you do that, and you do in other places, and you can have actually behavioral kind of program where you're going to reward your child. Suppose that your child likes to go to a specific, store. They go to Walgreens. I don't know if you live in the States, but if they go to Walgreens and they get this little thing for their collection, and if they say something even to you, if they are saying something to you and then they're going to say something later on to the person asking for a specific item, or to even say thank you, or to ask for direction or something like that, where are the brushes, or where is the nail polish, or so then you will buy that item for your child and hope it's the dollar store or something like that. I don't usually recommend necessarily having a reward every time, but I think in this case you can plan that activity and see how it goes. Of course, your child uses that voice because it's a way of it's handling their anxiety, but the more exposure you provide, the better it will be. Now, there is the question that you have, even, is my child desensitized in the situations? That's a very good question, because your child has not been 100% desensitized, because at school she's just answering questions. She's not volunteering information. And I think that the point that you brought that is really important for other parents to learn from is the fact that it's not just when they speak, but it's the nature of their voice and how they communicate, which is the language part. That's why Dr. Shiplon Bloom too says it's just not speaking, it's the communication and language that we talk about. So it's really important to know that you're not done yet. You did really well over the 2 weeks, but we need to continue moving. And in my opinion, success of treatment is when children use the same voice they use at home to use in public situations. But by the way, at home, some of the children with SM speak very loudly and they talk all the time, which is not appropriate in public. So it's a toss-up, but I think that you're doing really well. Congratulations in starting whatever intervention you're doing, and keep on working and exposing your child all the time.
Thank you so much. These are wonderful ideas. I'm sure our parents will cannot wait to try your strategies.
Thank you.